Welcome to the deep dive. Today, our mission is really to get under the hood of a specific genetic condition in dogs, canine phosphofructokinase deficiency.
Yeah, PFK deficiency for short.
Exactly. We've got some source material here that breaks it down, what it is, how it causes problems, how it's diagnosed, and really what it means for the dogs affected and their owners.
It can sound pretty technical, PFK deficiency, but the core ideas are
That's
important.
right. We're going to try and pull out the key stuff, maybe have a few of those aha moments, hopefully. Okay, so let's start right at the beginning. Phosphofructokinase, PFK. It's quite a name. What exactly is its job in the body? The sources say it's fundamental.
It really is. PFK is an enzyme, and the sources describe it as like the critical rate controlling enzyme in glycolysis.
Glycolysis. Okay, refresh my memory. Simple terms.
Think of it as the body's super quick way to get energy from sugar, from glucose, inside cells. It's sort of the first phase of energy production.
And PFK being rate controlling,
Yeah.
why is that specific description so vital?
Well, imagine it like the main tap on a hosepipe. If that tap, PFK, is working properly, energy flows. But if there's a deficiency, that flow gets really restricted.
Okay.
And that's especially bad for cells that need that quick energy hit.
Like which ones? Which cells are most affected?
The sources point specifically to red blood cells, RBCs, and also skeletal muscles when they're working hard, like during intense exercise.
Mm-hmm.
These guys really rely on what's called anaerobic glycolysis, getting energy fast, without needing much oxygen right then and there.
Okay, so if a dog has this deficiency, not enough working TFK, what happens? What are the direct consequences we see?
Right, so the main problem is that these dogs have markedly less PFK activity, just much lower levels in both their red blood cells and their muscles. And this leads, according to the sources, to two main problems. First, a type of anemia. It's called compensated hemolytic anemia.
Okay. Hemolytic means the red cells are breaking down.
Exactly. And second, they tend to have some muscle issues, a myopathy, though the sources say this is generally kind of mild.
Right. Anemia makes sense, not enough healthy red cells. But why does the PFK problem cause them to break down? Is it just they're not made right?
It's more about how they function. Because PFK is limited, they just can't make enough ATP.
ATP, the energy currency of the cell.
Precisely. And without enough ATP, the red blood cells can't maintain their proper shape or their internal balance of ions, or crucially, their flexibility. They need to be squishy to get through tiny capillaries.
And that lack of energy just messes all that up.
It does.
Now, here's something the sources highlighted that sounds really specific. Quite unique, actually. These red blood cells are called alkaline fragile. What on earth does that mean?
Yeah, this is a really critical point. It means these specific red blood cells are super sensitive to the blood's pH level. If the blood becomes just a tiny bit too alkaline, the pH goes up slightly. These fragile cells tend to lyse.
Lyse, meaning they burst.
They burst, yeah, right there in the bloodstream.
Wow. So a tiny shift in blood chemistry, maybe from something totally normal, can suddenly cause a massive breakdown. That's a key trigger mentioned.
It really is. Understanding that alkaline fragility helps explain why the disease often comes in episodes, in crises.
And the muscle problem, the myopathy, you said it's usually milder.
Generally, yes. It mainly affects muscle function, so you might see, the dog getting tired easily during exercise, that sort of thing.
Okay, so which dogs tend to get this? Are there specific breeds where this gene pops up more often?
Yes. The sources do list several. They mention English Springer Spaniels, American Cocker Spaniels, some mixed breed dogs too, Whippets, and also Wachtelhund dogs.
And how is it passed down? Is it inherited?
It is, yeah. It's an autosomal recessive trait.
Autosomal recessive. Okay, so that means a dog needs to get the faulty gene from both parents to actually show the disease.
That's exactly right. If they get just one copy, say from the mother but not the father, they become a carrier.
And carriers seem fine.
Yeah, the sources are clear on this. These heterozygous carriers, they look clinically normal, no symptoms. But they can pass that faulty gene on.
Right. And for the dogs that do get two bad copies, the affected ones, when do symptoms usually start showing up? Is it from birth?
Interestingly, no. The sources note that affected dogs, the homozygous ones, usually aren't even recognized as having a problem until they're over a year old.
So the problem's there genetically, but the signs take time to become obvious.
Exactly. It takes a while for the effects to build up enough for owners or vets to notice something's wrong.
That makes sense with the variability mentioned. The sources say some dogs might just have mild signs for years, but others get these regular, quite severe episodes. What does a severe episode look like?
Right. This is when that alkaline fragility really causes trouble. During a hemolytic episode, when lots of red cells are breaking down, the signs are pretty obvious.
Like what? What would an owner see?
Well, maybe just depression or weakness.
Yeah.
But a key sign is discolored urine. The sources call it red to brown pigmenturia.
Pigmenturia. So that's the hemoglobin from the burst cells spilling into the urine.
Exactly. And they make an interesting point that it might be missed more easily in female dogs just because of how they urinate.
Okay. And if it's a really severe crisis?
Then it's much more dramatic. The sources describe things like marked lethargy, just really wiped out, weakness, and pale gums, or maybe even jaundiced gums or eyes.
Jaundice, that yellow tinge from all the broken down red cells.
Yes, it's the bilirubin buildup. They might also find, a slightly enlarged liver or spleen, some muscle wasting, and often a high fever, sometimes really high, like 41 Celsius, which is
Over 105 Fahrenheit. That's serious.
very serious. And the sources point out that the fever itself can actually make the hemolysis worse. It
Yeah.
potentiates it.
Right. And we keep coming back to those fragile cells. What actually triggers these big bursting events? You mentioned pH.
Yes, the sources make a very direct link here. The crisis, the intravascular hemolysis, can be directly caused by alkalemia that rise in blood pH.
And what causes the alkalemia?
It's often induced by hyperventilation, heavy panting.
And what makes a dog hyperventilate or pant heavily?
Well, think about it. Strenuous exercise, getting really excited or stressed, even just being in a very hot environment.
Wow. Okay, so getting overexcited, playing fetch, or a really stressful vet visit or a hot day, that can cause panting, which shifts the blood pH just enough to make those fragile red cells basically explode.
That's the mechanism the sources describe. Yeah.
Understanding that connection, excitement, breathing changes, pH shift, cell destruction, that seems absolutely critical for anyone managing a dog with this.
It really is. It explains exactly why avoiding those triggers is the cornerstone of management.
You mentioned the muscle side earlier, the myopathy. How does that usually present?
Like I said, it's often mild, mostly just exercise intolerance. They tire out quicker than you'd expect, maybe a bit less muscle bulk. But the sources do warn that sometimes you can see muscle cramping, and in some rare cases, even a severe progressive muscle disease.
And there was that specific note about whippets.
Yes, an interesting detail. The sources mentioned 2 affected whippets that didn't just have the muscle cramping after exercise, but they also developed progressive heart disease.
Huh. So it can sometimes have wider effects than just the muscles and blood cells.
It seems so, yeah. A reminder that these genetic things can be complex.
Okay, so let's say a vet sees a dog with some of these signs, the weakness, the anemia, maybe that dark urine. How do they pinpoint PFK deficiency? Because hemolytic anemia can happen for other reasons, right? The sources list quite a few.
Absolutely. That's the first hurdle. Vets need to rule out other possibilities first.
Yeah.
The sources mention things like immune-mediated hemolytic anemia, where the dog's own immune system attacks the red cells,
Okay.
or certain infections like blood parasites, mycoplasmosis or babesiosis, or maybe toxins causing something called Heinz body anemia, even another genetic issue, pyruvate kinase deficiency, which can look similar.
Right. So how do they start crossing those off the list, according to the sources?
Well, dogs with PFK deficiency usually have specific findings that help differentiate. For example, they typically have a negative Coombs test, which points away from the immune-mediated type. And when they look at the blood under a microscope, they won't see those parasites or Heinz bodies. Lab tests would also be negative for things like Babesia infection or signs of clotting disorders or heartworm.
Okay. And telling it apart from that other enzyme problem, pyruvate kinase deficiency, how's that done?
That needs more specific testing, according to the sources. Either you measure the actual enzyme activity levels for both PFK and PK, or increasingly you use a specific DNA test.
What about just routine blood work? What does a complete blood count or a chemistry panel show in a dog with PFK deficiency?
You'll usually see signs of that compensated hemolytic anemia we talked about. So the anemia might be persistent, but not always severe between crises. You'll see a high number of young red blood cells, reticulocytes, as the bone marrow tries hard to replace the lost ones. Their red cell size, the MCV, might fall in a particular range. But the really striking thing is during a crisis, that hematocrit, the percentage of blood that's red cells, can just plummet down to 15% or even lower sometimes.
That's incredibly low.
Dangerously low, yeah. And the urine test, the urinalysis, will show that bilirubin and hemoglobin spilling out during a crisis. Blood chemistry can show a whole pattern of changes, maybe slightly high potassium, magnesium, calcium, urea, protein levels, often high LDH and bilirubin, especially bilirubin during a crisis. And if the kidneys start to fail because they're overwhelmed by all the hemoglobin,
Which the sources mentioned can happen.
right, hemoglobin nephrosis or shock can cause renal failure, then you'd see really high kidney values like urea and creatinine.
Paints a pretty grim picture of what's happening inside during a severe episode. So, what are the definitive diagnostic tests for PFK itself?
The sources mention two main ones. First, you can actually measure the PFK enzyme activity in the red blood cells. This works for dogs over about 3 months old. Carriers, interestingly, tend to have about half the normal enzyme activity.
But the gold standard, the best way to be sure.
That's the DNA test, using PCR technology. The sources really emphasize this one. It can clearly tell apart normal dogs, carriers, and affected dogs, and it works at any age, even in young puppies.
That seems crucial for breeders, too.
Absolutely. And remember that detail about the Wachtelhund dogs? The DNA test is what revealed they have a different genetic mutation causing their PFK deficiency compared to the one found in Springer Spaniels and Cockers and Whippets.
Fascinating. Same disease outcome, different genetic root. Okay, so we've got the diagnosis. What about treatment? Is there a cure for this?
According to the source material we looked at, the only actual cure is a bone marrow transplant.
Which is a huge deal, obviously. Not a routine procedure.
Not at all. So for the vast majority of dogs, it really comes down to management.
And what does that management involve? What's the focus?
It's mainly about supportive care, especially trying to prevent or manage those crises. If a dog does go into severe intravascular hemolysis, that massive red cell breakdown, then IV fluids, intravenous fluid therapy, are really critical. The main goal there is to flush the kidneys and try to minimize the risk of acute kidney failure from all that hemoglobin.
Makes sense. What about blood transfusions? Are they needed often?
The sources say usually not. The body is often compensating between crises, but if the anemia gets truly life-threatening during a crisis, then yes, a transfusion should definitely be given. And if there's a fever, which we know can make the crisis worse,
Right, potentiate it.
the sources mentioned using fever-reducing medications. They list aspirin or dipyrone as options to help bring the temperature down.
Okay, so given all that, what's the overall prognosis? Can a dog with PFK deficiency live a decent life?
It's a mixed bag, unfortunately. The sources state clearly that affected dogs can die during a bad hemolytic crisis, either from the anemia itself or from complications like kidney failure.
But there's a but.
There is a very important but. The sources also emphasize that these dogs can potentially have a normal lifespan if they are managed properly.
And that proper management, based on everything we've discussed, really seems to circle back to avoiding those specific triggers, doesn't it?
100%. That's the absolute key message for owners.
Mm.
Avoid situations that could kick off a crisis. So that means trying to keep them out of highly stressful situations, managing their exercise carefully, no sudden strenuous bursts, avoiding excessive excitement, and being careful about high environmental temperatures that cause heavy panting.
Because all those roads lead back to hyperventilation, alkalemia, and bursting red blood cells.
Exactly. Prevent the trigger, prevent the crisis.
Okay, so let's try and pull this all together from our deep dive into the sources. Canine Phosphofructokinase Deficiency. It's fundamentally a genetic problem.
Right, a flaw in a key enzyme needed for making energy, especially in red blood cells and working muscles.
And this leads to these episodes of anemia because the red cells break down and also some muscle issues.
Driven by that lack of energy, yes, but also critically by those alkaline, fragile red blood cells that are unusually sensitive to slight increases in blood pH.
And those crises, the really bad episodes, are often set off by things like excitement or hard exercise.
Because that leads to the panting, the pH shift, and bam, the cell's less.
Diagnosis involves ruling out other stuff, then confirming with specific PFK activity tests or, ideally, the definitive DNA test.
A test which can identify affected dogs, carriers, and normal dogs, regardless of age, and even pick up different mutations in different breeds like the Wachtelhund.
And while a crisis can be really dangerous, even fatal, the sources are hopeful that with really careful management, focus squarely on avoiding those known triggers.
Affected dogs really can live a normal lifespan. It requires vigilance, but it's possible.
Thinking about this whole picture, especially that really striking link between something as everyday as excitement or exercise triggering a life-threatening event just through a slight change in blood chemistry, it makes you wonder, doesn't it? What does that suggest about maybe hidden genetic factors influencing how any animal, or maybe even us, reacts to what seem like normal environmental stresses?